In this video, I'm going to go over a subacromial decompression of the shoulder. And this is going to be where the doctor maybe has sent you home and just said, look up some exercises, use your arm as normal after a few days, and you wonder, what can you really do? So I'm going to go over what is a subacromial decompression, and then what are some things you can do at home to improve your range of motion, return your strength, and improve function of your upper extremity. A subacromial decompression, also known as a SAD procedure, is where the surgeon goes in under this space here known as a subacromial arch, shaves underneath this. A lot of times we get bone spurs, little pieces of osteophytes or bony fragments that kind of stick down. That can rub and fray the rotator cuff tendons here. And so they're going to go in and shave that, clean that up. They may have to clean up some of the tendons if there's been some kind of rubbing on those tendons. A lot of times they'll also do a bursectomy where they take the bursa sac out. That's a fluid-filled sac in this space. They're going to remove that to create a little more space. Now, in this video, this is really geared towards more just a traditional subacromial decompression without a rotator cuff repair. If the rotator cuff tendons had to be repaired, in that case, you're going to definitely want to follow a specific protocol. And as always, if there is a protocol you should be following, you want to make sure and do that. But for our purposes in this video, we're going to say that the physician cleared you to go do whatever you want to do to regain your range of motion and strength. One of the things we want to do is restore range of motion as quickly as possible. I like this technique, this tabletop slide, where you take a pillowcase, you can take a towel. We're going to say it's my right shoulder that's affected. I'm going to put my hand down, take my other unaffected hand, put it on top here, and I'm going to go forwards as far as I can, really reaching forwards and come back. And I'm going to repeat that for 10 to 15 repetitions just throughout the day. That may be something you perform 10 times a day, 15 times a day. You can also do that where you take this and slide up and down the wall. I don't mind that technique, but I think initially if you do have some pain in this area, and it's common to have some pain and irritation, especially when they shave on that bone, you're going to have that pain for a while, so you may find it easier to go on a tabletop slide or a countertop versus sliding up the wall. The next movement is going to be a cane-assisted range of motion exercise. You're going to take a piece of PVC pipe. You can use a walking cane, broom handle, whatever you have. You can do this in standing, lying, sitting, just your preference. I'm going to stand, we're going to say against my right shoulder. I'm going to use my left arm to kind of pull my right arm up as high as I can go. I'm going to go up as high as I can go here and then come back down. Repeat that for 10 to 15 repetitions for a couple of sets, several times a day. Then we're going to go out the side, what's known as abductions. What I'm going to do now is take my hand, put it on the end of the cane or the pipe here. I'm using my left arm to kind of push my arm out to the side. Now I am using my right shoulder, those muscles in my right upper extremity, to perform this movement just like the one before. I'm just using my left arm to kind of assist with that movement and also control it as it comes down. So if I didn't have that, that just may kind of drop and be uncomfortable, may hurt, and you're also a little apprehensive of it hurting, so you kind of use this to slowly lower that back down. And you're going to do that the same way, 10 to 15 repetitions, 2 to 3 sets, several times a day. Now we're going to perform a band-resisted internal rotation exercise. I'm going to bring my elbow into my side. I have the band fastened over to the door. I'm going to work on bringing my hand in towards my abdomen, just pulling in. You're going to complete that for 2 to 3 sets of 10 to 15 repetitions, once to twice a day. I would start these exercises within the first week after surgery. Initially start with those 2 range of motion exercises that we were doing before, both with the pillowcase or a towel slide and the cane exercise. Really focus on those for those first week or so, and then you're going to start adding in these band exercises. If you're feeling pretty good and there's no restrictions, you can go ahead and start adding the band exercises, usually within the first 3 to 5 days. Now we're going to perform scapular protraction using that same band. So what you're going to do is just kind of push forwards and come back, nice, slow, and controlled, forwards and back. When you come back initially, you may want to keep the elbow kind of by the side and not let it drop back too far. That may irritate the shoulder, and that's just preference for me. I usually have my patients start doing it just like this, kind of partial repetitions here, 2 to 3 sets, 10 to 15 repetitions, once or twice a day. These are going to be scapular retractions. I'm going to, for the purpose of the camera, kind of spin around. I'm going to use my left shoulder now, and you're just going to kind of pull back as far as you can, going forwards, pull back. I keep my elbow pretty close to my side initially. You can work on bringing the elbow up higher, but initially I like to keep it down by the side. You're going to complete that for 2 to 3 sets of 10 to 15 repetitions, once or twice a day. Our last band exercise is going to be external rotation. Same band, elbow by the side. Again, I'm using my left shoulder for the purpose of the video, and you're going to go out to the side and come back across out to the side, back across. You want to make sure initially the band is such that you can control the arm and it's not so much that you can't pull it at all. You want to be able to bring the hand out. If you're doing this and the elbow kind of flares out to the side, you can't keep it tucked into your side, reduce the resistance on the band and take a towel, a small towel, roll that up and put that between the elbow and your side. That works really well at being able to control that and keep it next to your side. You're going to want to perform 2 to 3 sets of 10 to 15 repetitions. Next, we're going to use light dumbbells to perform what's called standing Ys. So you're going to kind of come up like this and back down, up and back down. You're going to perform this for 2 to 3 sets, 10 to 15 repetitions. Make sure with this that the weight is such that you can control it. Want to try to reduce having a shrug sign. So again, we're going to say it's my right shoulder that's affected. You don't want the right shoulder to look like that when you're trying to bring the weight up. So reduce the weight. If you can't do that with using even a 1-pound dumbbell, take the weights away completely and just focus on nice symmetrical movement going up and back down. Also, another point with that may be you may have to stop at about shoulder level instead of going overhead. It may increase your pain too much to go all the way overhead. So initially just start stopping at shoulder level and then come back down. Now we're going to work on shoulder abduction. So same dumbbells, you're going to go straight out to the side and then back down. You're going to perform this for 2 to 3 sets of 10 to 15 repetitions. If you want to bend the elbows a little bit, you can, just like the traditional lateral raises that you would perform in the gym. But if you'd like to keep the elbows straight, that works well too. Just make sure, again, this is a weight such that you can control it and you're not getting this kind of shrugging sign where the trap is really doing a lot of work to try to bring the arm up. This exercise is going to be called band pull-aparts, where you're going to basically take the band, you're going in what's known as horizontal abduction. You're going to pull the band apart, really squeezing the shoulder blades together, and then come back to the front. Pull the band apart, really focus on squeezing the shoulder blades together, and then coming back to the front. Perform that for 2 to 3 sets, 10 to 15 repetitions. And again, make sure you're starting with a band that's light enough that you can control the movement, and it's nice and easy to perform, and then you can progress over the next few weeks. Our last movement that we're going to perform are standing A's. So you're going to take a band, you can have one with handles, it can be just a piece of band like the blue one that I had previous. You're going to fasten it up somewhere high that's nice and stable, and you're going to focus on keeping the elbows straight, pulling your arms and hands down beside your body, coming down, 2 to 3 sets, 10 to 15 repetitions. So what that kind of looks like is there. So we're making an A. Basically, when we come down, we're making the letter A, a capital letter A when we come down. Really squeeze those shoulder blades together. That's a great exercise to work on the lower trap area to try to help with scapular rotation, because that's important. Upward rotation, we're trying to reach overhead. That is an intro program for a subacromial decompression without rotator cuff tendon repair that you can do at home if your physician has basically said, go find something to do, work on whatever you want to work on, you're good to go. That whole program should take somewhere between 4 to 6 weeks. In most cases, patients within 6 to 8 weeks are returning back to normal functioning, with the exception of elite athletes or an industrial athlete. That may take a little bit longer, but generally speaking, about 6 to 8 weeks. Hope this video helps, and thanks so much for watching.